my name is Andrew Green, PN student, and today I'm going to be demonstrating inserting and removing an NGT tube. So I have my provider orders here, and I have patient Shirley Cost. Her date of birth was 5/14/64. Her doctor is Dr. Leo. She's in room 211-1. And I see that she was admitted to med-surg on the 14th of October for a small bowel obstruction, and there's an order for an NGT tube now. So I'm just going to do my hand hygiene quickly, and then I'm going to make sure I have all the correct supplies before I enter my patient's room. And I should have mentioned that I'm in my med room right now. So I'm going to start. I have my syringe, and with that I have my pH strip and medicine cup to test the pH of the stomach contents. And then I have my tape and a safety pin. I have a cup of water, which I will put ice water in before I enter the room. I have my lube for the tube, and I have my strip to hold the tube in place. I have my alcohol preps and my adhesive remover wipes. I have my tongue depressor and my pen light. This is for if the patient were to start gagging or coughing profusely, which would mean the tube curling back in the back, the tube curling in the back of the throat, which I would check with that. I have my marker to mark my tube. I have some Kleenex for the patient in case their eyes start to water, and I have my kidney basin. I have a towel for the patient, and I have my tube, which is a 14 French by 48 inches. So I can see that I have all my supplies necessary. So I'm just going to, I can now enter my patient's room. So I am knock knock, and I will close the door for privacy. Hi, how are you doing today? Not so well? You're not feeling well? Oh, well, can I get you to confirm your name and date of birth for me quickly? Shirley Coast. 5/14/64 and 5/14/64. Okay, so I know I have the right patient, so now I can go ahead and continue. So you said you're not feeling well today, Shirley. No, and where's your pain located? In your abdomen? And on a scale of 0 to 10, what would you rate your pain? 10 being the worst pain you've ever felt in your life. About a 7, okay. And is it a dull or a sharp pain? Can you describe it for me? It's dull. Okay, I'm gonna auscultate your, I'm gonna listen to your bowel, Shirley. I see that you have a small bowel obstruction. Yeah, so I'm just gonna listen quickly. Okay, Shirley, and I can hear that you have hypoactive bowels, so we can go ahead to insert a tube. I have an NGT tube, which is a nasogastric tube, and it's going to go up your nose and then down to your stomach, and it's going to relieve all that pain that you're experiencing in your stomach. It's going to be a little bit uncomfortable, so we're going to have a mutual hand sign. If you give me a thumbs up, it means that you're good and you can keep going, but if you hold up a stop sign, it means that you need to stop and you're just too uncomfortable, or you are having respiratory issues. Do you understand those hand signs? Okay, perfect. So I'm just going to prepare my supplies, Shirley. Do you have any questions for me before we begin? No? Okay. So I'm just going to put on my gloves, which I've already done my hand hygiene. And I'm just going to remove this pillow from behind your head, Shirley. Just going to place it there for now. Okay, Shirley, so I just have to measure the tube to know how far I have to insert it. So I'm going to go from the tip of the nose to the earlobe, and then down to the xiphoid process. Okay? And then I can take my marker and put a mark on where I need to insert it to. Okay. Okay, Okay, Shirley, so I just have a towel here I'm going to drape across your chest. And then I also have some Kleenex for you, just in case your eyes start to water or your nose starts to drip. And you can wipe with that. And then I have a kidney basin for you. And I also have a glass of ice water. So I'm going to clean Shirley's nose first. So Shirley, I just have an alcohol prep, and I'm just going to wipe your nose to get any oil or grease off, and then just wipe a little bit in the nose. Okay. Okay, and while that dries, I'm going to lube my tube. So I would dip it into my lube about 4 inches, and then it would be lubed. But because we need special lube for these mannequins, I will not actually be lubing it. But just so you know, I would lube it. Okay. So now we can get started. Shirley, do you have any questions before I begin? Do you have any concerns? No? Do you remember our hand signals? Yes? Okay. So I'm going to start with the head tipped back. Okay, Shirley, I'm going to insert the tube now. Okay, so I'm just inserting it. Okay, and now I hear Shirley gagging, so I can pull back 1/8 of an inch. Are you still okay, Shirley? Thumbs up? Okay. So now I'm going to put your head forward. So our head would be forward. And Shirley, I need you to take a sip of ice water. Good, okay. And I'm going to tell you to swallow, and each time I'm going to advance the tube. Ready? Swallow, 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 swallow. Keep swallowing. Good, okay. So now the tube is all the way in. So I can put the strip on Shirley. So I know we had other strips for the video, but because I am re-recording today, I am going to use this one. Are you okay, Shirley? Thumbs up? Okay, good. Okay, so now that that is secure, I am just going to take my marker and mark where it is in her nose there. Okay, and now I'm just going to secure it to your gown, Shirley, before I continue. So I'm just going to take a piece of tape, and I'm just going to put it around the tube, and then safety pin it to the gown so it stays in place. Okay, Shirley, are you feeling okay? Yes? Okay. So now I'm just going to aspirate and get some stomach contents to test the pH. And I should have said before that I would make sure that this is looped so no fluid could come back out the tube, which it was already looped. I had done that. So I'm just going to take this. I'm going to take my syringe and I'm going to aspirate 10 milliliters of air. And then I can take this off. Okay, and then I'll just withdraw some gastric fluid. Okay. And then I will put it into my medicine cup. And then depending on whether this needs washed or disposed of, I would put it in a biohazardous container or whatever facility policy is. And then I will dip my pH strip into the contents and I will compare it on my chart, which it looks like it's about a 3, so that's normal. And then I would dispose of this as per facility policy in a biohazardous container. Okay, Shirley, so how are you feeling? You're okay? Oh, that's good. Okay, so I'm going to be back in a little bit to check on you. We're going to get an x-ray to make sure that the tube is in place before I can hook you up to suction to help with that stomach pain. Okay, do you need anything before I leave the room? No, you're okay? Okay, so at this point I would tidy up my room and my workspace, make sure my patient is in a comfortable position, which we're just going to leave them in high Fowlers as I am going to demonstrate removing it. I would replace the pillow if they want and they're comfortable with that. After x-ray, I would come back and hook them up to the suction machine, but we have to have the x-ray to make sure that the tube is placed correctly. So now I can move on. I'm back in my med room and I'm just going to clean up my space a little bit as I prepare to remove the NGT tube. So I'm back in my med room and I now have a new order for Shirley. I see that she's been hooked up to suction and her pain must be managed, so we're going to remove the tube. So again, I have patient Shirley Coast, date of birth 5/14/64, Dr. Leo, room 211-1, and we have an order to remove the NGT tube today. So I'm just going to perform my hand hygiene, and I've already gone over my doctor's orders, so I can make my way to my patient's room again. So knock knock, and I would shut the door for privacy. Hi, how are you today? You're good? Oh, and how's your pain? It's better. That's good. So can I just get you to confirm your name and date of birth for me? Shirley Cost, 54, okay, and 5/14/64? 5/14/64, perfect. So I have the right patient. So Shirley, today I have an order to remove your NGT tube. You're feeling much better? Oh, good. And so what would you rate your pain today, a 0 to 10? You'd rate it like as a 1 or less, really? That's great. Okay, so I'm just going to listen to your bowels, Shirley. Okay. Okay, Shirley, so your bowels are definitely active, and that's a good sign. So we can go ahead with removing your tube. So I've done my hand hygiene. I'm just going to grab some gloves. And then I can continue. So Shirley, do you have any questions for me before we remove the tube? No? Okay. So it is going to be uncomfortable again. I'm going to have you hold your breath, and I need you to take a deep breath and then hold your breath when we're going to remove it, as it'll make it a little bit easier for you. So I'm just going to remove this from your gown, Shirley. Good. Okay, and then I would remove it from suction, as she would have been hooked up to suction now. So I'm just going to put this across your chest. And again, I have my gauze, and I have some Kleenex and an extra towel. So again, I have some Kleenex for you, Shirley. I'm just going to take this adhesive remover to help remove the nose strip. Okay, Shirley, so I'm going to take my gauze and I'm going to wrap it around the tube. So I have some grip. Okay, Shirley, I need you to take a deep breath and then hold it. Okay, so she's taking a deep breath and now she's holding it, and I can just pull the tube straight out. Good, okay, and it's out now, Shirley. And then I would wrap it up into a towel and dispose of it as per facility policy in a biohazardous container. And then I have another towel just to clean up Shirley's nose. Okay, Shirley, so I'm just going to listen to your bowels one more time. Okay, and those sound good. They're still active. How are you feeling? Good? Okay, so I'm going to come back and check on you in a little bit. Make sure you're still feeling okay. Do you have any questions for me before I leave? No? Okay, so then I would put my patient in a comfortable position, make sure they're okay, tidy up the room, tidy up my workspace, and I would go back to the nurse's station and document, do my hand hygiene, and then I would do the input and output form, which I have over here. So I would fill that out. And then after making sure my patient is okay, I have documented and cleaned up all of my workstations. That'll conclude this video.